Welcome back. It's Dr. Jennifer Boney, Doctor of Physical Therapy, better known as Doc Jen Fit, owner and founder of Gen Health, your platform for all things aches, pains, or just wanting to feel well within your body. So we're really focusing on pregnancy right now, since that is very much where I'm at. And I'm going to do a little mobility flow with you for upper back issues or rib discomfort. This is what I hear a lot during pregnancy. So I want to make sure that I'm kind of setting you up to feel something different within your body. And this flow is my go-to right now. It feels so amazing. Now, all you're going to need for one of the exercises is a foam roller. Now, I am using IntelliRoll foam roller because when I do something that I want to open up my upper back, it has space for my spine, plus some acupressure points that feel amazing along the muscles. And if I'm getting into my legs at all, it has this curved surface that fits into my body, especially if I'm doing something like low back or QL, getting into those areas, those harder to reach areas on a typical foam roller. This is why for years now, I have been using IntelliRoll, and I do have a discount code DocJen, and I'm going to link that up so that you can get your own IntelliRoll for home. I highly recommend. Like my friends have it, my family members have it now. It's amazing. But let's get into it. So we're going to start with a little rib cage dig. So I'm going to lay down, and this is something that you can have your partner do on you as well. If you don't feel comfortable laying all the way on your back, I highly recommend getting like a wedge pillow or setting up pillows so that you could be more at an inclined angle. And you can even do it on one side versus another. And sometimes getting a partner to do this for you feels really good so that you can completely relax and just focus on breathing. But what the idea of a rib cage dig is that we have our diaphragm underneath our rib cage. And if I reach underneath and I try to get my fingers underneath my rib cage, and it might feel a little sensitive to you, I'm going to try to hold on and take a breath into my fingers, into that rib cage. During pregnancy, our diaphragm gets compressed and flattened. And so it makes it really hard to find this diaphragmatic breathing, which is why we end up feeling a lot more increased sensitivity of pain. Maybe we feel a lot of tightness. And especially along the rib cage area, it's super common to experience that tightness. But getting this release and this kind of down regulation in our body helps everything along the belly. So this is something that I've really been focusing on. You really only need to do like 5 to 10 breaths on each side. It doesn't have to be for too long, but make sure that those breaths are going slow. So you want to get into that area of the rib cage and then take a breath in really slow to where your fingers are, not in your upper chest or neck. So where your fingers are. And then relax, even longer exhale. Either out your mouth, out your nose, like whatever you want to do. Okay. Whatever helps you to get into that more relaxed state so that we can start to free up movement of that rib cage and help with the breathing, help with oxygen, especially since it's already getting so compressed during pregnancy. Now, next thing, I'm going to grab the foam roller here. And I'm going to put it into my upper back. And again, getting into this, however feels comfortable for you, you want to get it right into the middle of your spine and have it toward the upper back. Now I'm going to place my hands and actually wrap my elbows in. And when I wrap my elbows in, this kind of gets my shoulder blades out of the way. Now you want to tuck that tailbone under, so you don't want to be arched from that low back. So tuck that tailbone under and relax your body, and then breathing in, breathing out as you melt over that foam roller. So now that we got that expansion from the front of that rib cage, we're kind of working through movement now in the back of that rib cage and spine. So this is another area that gets really kind of hunched and tight during pregnancy because we tend to shift our pelvis forward with the weight of the belly and round into the upper back. So that's kind of like a normal patterning. And you can just kind of make your way down the foam roller, opening up, keeping that tailbone tucked under. You can hold it, you can move into it, kind of wiggle, take some breaths. So kind of moving as as you feel within your body, spending about 1 to 2 minutes here, or doing it about 10 to 15 times. So it's a great way to kind of just start to relax tension through that upper back, get it moving in a different direction than is what is super typical during pregnancy, especially if you have littles that you're already taking care of. If you're chasing around toddlers, holding toddlers like I am, then you understand getting a little bit more of that roundness in that upper back is super common. So doing some things to combat that is going to be key here. Okay. Then we're going to work on some open book. So I'm just going to lie down. Now, what's really helpful during pregnancy is having especially when you're further along, is having like a set of pillows to kind of hook underneath your leg so that you're not dropping too much in your low back and causing some discomfort around that belly area. So I'm actually going to grab a large pillow here for myself and stick it underneath my leg, so that now my knee is in line with my hip and I'm not putting extra pressure down into my belly, making it feel uncomfortable. Reaching forward, taking a breath into that back of the rib cage. Breathe out as I pull open and relax. Now I'm going into like a football post here because I have a couch in my way, but you can definitely let the arm extend. Breathing in, breathing out. And we'll do just about 5 on each side, but you can certainly spend a bit more time here. Sometimes doing 10 to 15. Like this is my go-to one every day as well. And I'm telling you again, a lot of times during pregnancy, we end up building that stiffness in the upper back. Sometimes we forget we can rotate through the upper back when we walk. And so getting that open extension and rotation and maintaining that through the upper back is key. And again, sometimes we're afraid of twisting, but that's why we want to use pillows and support to kind of lock that lower body down. So it's more that we don't want to extremely twist through the low back and through the belly area, but we do want to twist and maintain that mobility through the upper back. So that's crucial and key here. Okay. And then we can switch to the other side. So it can be anywhere 5 to 15. You can do this as needed and as desired. Oh, I am quite restricted from my mic pack, so I'll move a little bit. So I can't reach all the way forward and all the way back with having this restricted mic pack. There we go. Hopefully you can still hear me okay. Breathing in as you reach, really opening that upper back, breathing out and allowing that chest to kind of melt that upper back to open. Breathing in, breathing out. So about 5 to 15. I do have a bit more mobility on this side of my body than I do on my other. Again, normal to have differences side to side. And because we're human, we're not perfectly symmetrical beings. We are perfectly asymmetrical beings, and that's totally okay. Then we're going to move on to cat-cow. So placing your hands underneath you. If you have a lot of wrist pain, you can either come up, you can fold the mat underneath you so your palms are a bit elevated, or you can even place your elbows onto a low ottoman. Okay. And with the cat-cow, you really want to make sure that we're extending and stretching. Again, we can build up a lot of tightness around the area. So relaxing and letting the shoulders drop. Exhale. Let it relax and stretch. Inhale. Come up. Inhale into that upper back, expanding from that rib cage again. And then exhale. So this might be a different breath pattern than you're usually used to. And it's because we want to stretch that tissue with the exhale where we get that relaxation. Inhale, we want to expand from that rib cage where we're already restricted. Exhale. And let that body melt and relax again. We'll do about 5 together, but you could do 5 to 15. Listen to your body, certainly. If you need to spend a little bit more time, So we spent time opening up that rib cage. We spent time opening up that upper back. Now we're getting that tissue to kind of relax as well along that abdomen and up into that rib cage area, around that rib cage. Relaxing. You can rock side to side. So kind of doing and feeling what feels good for your body. But going into as much extension as you can to really work on starting to open up. Then last thing, we're going to end a little bit more active into that rotation. So now that we did the open book, we're going to do an active open book. So being in this child's pose with your legs apart, knees apart, hand behind your ear, you're going to inhale as you press down and rotate as much as you can. Exhale. So we inhale on the way up. That actually expands the muscles along the rib cage, which is where we're trying to get more range of motion and make it a little bit more active. We're going to do 5 on each side. Again, if you ever wanted to spend a little bit more time here, you can do 5 to 10 on each side, really getting it active. So as much as I love passive mobility and it feels so good to just stretch and relax, this is a great way to make sure that after you end your mobility session, your body has some familiarity to kind of go into this position again, to be able to use that extension and hold it. So this has better long-term carryover by making the muscles work and kind of reprogramming the brain. Okay, so I want you to come back to this flow as needed. But another thing that I have been really working on, and it has all of these and so much more, is the full body mobility plan that we have on Gen Health. And someone asked me the other day, I am into my pregnancy, into my second trimester. What do I know what to do for mobility every morning? And you don't have to think. And that's the great thing about the full body mobility plan. I have already laid out the videos for you. You can modify anything on your stomach to sitting on an elevated surface or reach out to me and I'm happy to help you. But you can follow a plan, 5 to 15 minutes. It doesn't have to take very much time, but I'm telling you, it's helped me relieve round ligament pain. It's helped me to feel like my baby gets into a better position because I'm relaxed around my rib cage and my abdomen and my hips. And we go through the full body in this plan. Now you can start a week completely free. You can even start your first month for just $20. Use code mobility and we're going to have that linked up in the description and above. And if you want to check out anything else, of course, please don't forget to subscribe so that you don't miss out on future videos. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.